Thank you very much. Good morning. So, I, like Mariana said, I work at Brigham City Community Hospital. I do cardiac rehab there. I just started working there about a year ago, but I've done cardiac rehab for a total of 11 years now. So when she called us and asked if someone would be interested in coming to talk to you about heart attacks, I was very excited. Have you guys ever heard of a heart attack before? Yeah. What do you think of when you hear the words heart attack? What are some images or some thoughts that come to mind? Pain? Clutching their chest. Uh-huh. Does it give you warm, fuzzy thoughts or kind of makes you kind of scared and tense? How many of you guys know someone who's had a heart attack? Everyone. It's very common. I looked up some statistics because that's what we do with presentations, right? We always give statistics first. So the American Heart Association said that about every 40 seconds, someone in the United States is going to have a heart attack. All the time. And heart disease, that includes high blood pressure and strokes, is still the leading cause of death in the United States. So it's very common. It's a huge problem. Everyone has heard about it, knows a little bit about it. But in my line of work, I have realized there's still some confusion and some misunderstandings out there about heart attacks. So my job today is to explain it in a way so hopefully you guys aren't as scared about it, aren't as apprehensive about heart attacks. You know how to recognize one and how to avoid one. I really think that the more that you know about something, the less frightening it is, especially when it comes to something in the medical field, because all doctors and nurses use their own language and we don't necessarily understand all those weird words that they're saying. We can skip through.
Skip this one?
Mm-hmm. There we go. So I think to understand what a heart attack is, we need to do a little anatomy lesson first and understand how the heart works. So everyone has a heart. I haven't met anyone yet that doesn't. A physical heart. If you make a fist, that is about the size of your heart. So everyone, we're all different shapes and sizes. Our fists are going to be different shapes and sizes. Your fist is going to be bigger than mine. Your heart's going to be bigger than mine. It sits right under your breastbone in your chest. It's a muscle, and it pumps blood through your body. It circulates the blood through your body. It takes oxygen-rich blood out to your tissues, and then it brings it back after it's been used up, sends the blood back to your lungs to get more oxygen. If you'll skip to the next slide. This is just easier than just reading my explanation. I think it's easier to understand what's going on. So we've got two pictures here. We've got a diagram of the inside of the heart and then one of the outside. The heart is a 3D object. So this is the best I could find to explain what happens. The heart is not red and blue like it looks in the picture. That's just a good visualization of the blood flow. The blue side is the oxygen-depleted blood coming back to the heart. The red side is oxygen-rich blood. So there's 4 chambers in the heart. There's 2 top chambers, 2 bottom chambers. There's a left and a right side. The 2 top chambers are called your atria. The 2 bottom chambers are the ventricles. So when your blood comes back to your heart, it comes in, you can see it says superior and inferior vena cava on the right side. Those are veins. It returns blood back to your heart from your body through the right atrium and the right ventricle, and that part of your heart pumps it to your lungs to get more oxygen. So it leaves your heart, gets oxygen, it comes back through your left atrium into your left ventricle. Now that blood has oxygen, and that side of your heart pumps it out to the rest of your body. It leaves your heart through the aorta. You can see that at the top of that picture. That's the largest artery in your body. And it sends oxygen and nutrients to every cell in your body. The blood that your heart is pumping, that's moving through your heart, does not give your heart the oxygen and nutrients that it needs. Those are just like storage tanks. Your heart gets the blood and oxygen that it needs from the outside in. You have arteries that come off of your aorta. They wrap down around your heart, and they feed different parts of your heart with blood. Normally, we have 3 different arteries there. They're called coronary arteries. They'll feed the front and the back and kind of the side of your heart. And of course, smaller arteries come off of that, so every cell in your heart gets blood that it needs. Before we go any further, I want to talk about the 3 different systems that the heart has. You think it's got a very basic function. It's just pumping blood. It's a very complex organ, though. So there are 3 systems to the heart that I like to think of. There's an electrical system, which is what we see when we do an EKG and you see the bumps. That's the electricity in the heart. There's the mechanical system. That's what guides the blood through the heart and makes sure it goes in the right direction. And then there's the plumbing system, which is what we're talking about today. That's the coronary arteries. That's what's feeding your heart oxygen and blood. So, what is a heart attack then? It's not getting attacked by hearts. I'm really not a cheesy person, but I really enjoyed that slide. A heart attack, you can see it, there we go, is when you've got a blockage in one of those coronary arteries. It cuts off the blood flow, and the portion of the heart below that doesn't get the oxygen and nutrients that it needs. And just like any other part of your body, if you think about like a kid who wraps a string around their finger and it starts to turn blue and you're like, get that off, your finger's going to fall off. It's kind of the same idea with your heart. If your heart's not getting oxygen, it's getting damaged. So I like this picture. It shows where the blockage is in the artery, and then it's kind of got a purple area to show the part of the heart that's being affected by a lack of oxygen. If your heart goes without oxygen for long enough, it becomes damaged, and that part of the heart can actually even die. And it can't be reversed. So most people think heavens now can survive a heart attack. Every once in a while you do hear of fatal heart attacks, but if you treat it, you can survive it. But that damage is still there. And it affects how well your heart pumps, how well it beats. Your heart's supposed to beat in perfect rhythm. Everything squeezes like it's supposed to. If part of your heart's damaged, it's not moving. It's not pumping along with the rest of your heart. It's just sitting there. So your heart kind of gets out of whack, and it has to compensate for that. And over time, that can cause some long-term health problems. It can cause some heart rhythm problems. It can cause some heart failure issues. So if we can avoid a heart attack, if at all possible, that's what we want to do. I think I already discussed this part, so we can move on. Okay, the most common cause of a heart attack is coronary artery disease. Other things can cause blockages in your arteries and cause a heart attack, but this is the most common. We're going to talk about this today. Coronary artery disease is the buildup of plaque in your arteries. Plaque is mostly cholesterol buildup. There are other things that are part of it, but we'll just think of cholesterol at this point. The top artery is a normal, healthy artery. It's flexible. Everything's flowing through it smoothly. The middle artery is the startup of coronary artery disease, of plaque, and then the bottom one is a very diseased artery. It's almost completely full of cholesterol buildup. Coronary artery disease actually starts when we're pretty young. They did autopsies of young soldiers in Vietnam, and they found the start of coronary artery disease in these young kids. And it just gradually builds up over the years, depending on choices that we make, what we eat for dinner, whether we exercise, and we don't notice it until it's about 70% blocked. Most of us are walking around with some degree of coronary artery disease. Normally it's fairly minor. Like I said, we don't notice it till it's 70% or more. Eventually, that blockage can become 100% with the cholesterol. That can cause a heart attack. What's more likely with a heart attack, though, is we aren't aware of this happening in our body. We have some plaque buildup, but we're cruising along just fine. And then we have a sudden stressor in our life. We're exerting ourselves physically in a way that we're not used to. We're shoveling snow. We've got a deadline we have to meet at work, and we're really stressed about that. That causes extra stress on that artery with that little bit of plaque. It makes that plaque break open and rupture, and it forms a blood clot and instantly closes off the artery. That's what most likely happens in a lot of heart attacks. That's a common scenario. I don't know if I can play this video, but we got farther along than I did at my last presentation. You want to try? Nope, okay. Anyway, it's an old quitting smoking ad. I found it on YouTube, but have you guys ever seen it where they take an artery and they squeeze the plaque out? I was going to make it optional if you wanted to see it or not. Anyway, I think it's just a good visualization of what is actually in our bodies. All right, so what does a heart attack feel like? What have you guys heard? Pain in your left arm, an elephant on your chest.
What I didn't realize is back pain. Years ago, went listening teaching to a woman who complained about back pain and said that she had flipped her mattress and that she felt like she had hurt her back. And we said, you better get to the doctor. She actually went to the doctor. They sent her home. She died that night.
Mm-hmm.
It was horrible. We felt guilty. I know.
Well, and there's a couple of good points with that. Yeah, unfortunately, unfortunately, heart attacks aren't everyone clutching the left side of their chest and their arm and dramatically falling over. There are more subtle symptoms like back pain. And along that note, women tend to have more unusual symptoms than men. So it tends to go unrecognized. Doctors are finally starting to catch on, but women tend to complain more of nausea, lightheadedness, feeling cold and clammy, not necessarily the gripping chest pain that we all think of. One of the most common things that I hear in my line of work is, I just was getting tired all the time. I was mowing my lawn. I had to stop 3 times to mow my front yard. Or I used to take the stairs all the time, but I had to stop because I had to catch my breath when I got to the top of the stairs. Those are symptoms. It doesn't mean you're having a heart attack then. Those are more warning signs. Dizziness or lightheadedness, nausea. Sometimes you can have a heart attack and not realize it. I know that sounds scary. I have had people come through my program and they'll say, yeah, I didn't even know I had a heart attack. I went to my doctor and he did an EKG and asked when my heart attack was. I don't know. Because you can have a few days where you just feel under the weather. You can feel nauseated, cold and clammy, tired, and then after a couple days you're better and you move on. Those are relatively minor heart attacks, but those are still symptoms to be aware of. Heart palpitations, your heart racing or skipping a lot of beats. Heartburn. I really hate this because a lot of times a heart attack does feel like heartburn. And what you do to treat your heartburn will help relieve the symptoms of a heart attack too. If you've got burning pain in your chest, up into your throat, you think it's heartburn, what are you gonna do? Chew Tums, you're gonna sit down. I mean, it's uncomfortable. You're gonna chew your Tums, you're probably going to rest and wait for it to work. While you're resting, if it's a heart attack, that gives your heart a break. It's not being stressed as much. And so those symptoms will resolve too. So it's hard to tell the difference sometimes. Okay, more typical symptoms, heaviness in your chest, an elephant sitting on your chest, jaw pain, pain going down one or both of your arms, or pain between your shoulder blades. If you think you are having symptoms of a heart attack, don't ever be embarrassed to go to the hospital or the doctor. No one is ever going to make fun of you for being worried that you're having a heart attack. You should call 911. That is ideal. I know some people live way out in the country. I know some counties or areas have like volunteer paramedics. So if you have to, as a very last resort, have someone drive you into the hospital if you think that will be faster and that's safer. Never drive yourself. But ideally, you'll call 911. While you're waiting for the ambulance to come, chew an aspirin. Aspirin is a mild blood thinner, so it's going to thin your blood and maybe get a little through that blockage to help your heart survive, or that part of your heart survive. And the paramedics are going to start treating you as soon as they come. They're going to give you oxygen, they're going to start some meds, run an EKG, they're going to let the hospital know that they're on their way with you so the hospital can be ready, because the sooner they can restore blood flow to your heart, the less damage is done. Time is muscle. So who can have a heart attack? Not me. I'm not old enough to have a heart attack. Or, no, I'm still in fairly good shape. I'm just getting old. I turned 62 last week. It's just finally catching up to me. Let's talk about what puts you at risk. So there are what we call risk factors for heart attacks, things that you do or don't do that affect how likely you are to have a heart attack. And there are some things that you just automatically have that you can't change. So things you can't control, your gender. Most of us don't control that. If you're male, you're more likely to have a heart attack, especially if you're over the age of 45 for men. Women tend to catch up to men around 55 or after menopause is really what that is. It's not so much that age. Estrogen has a protective effect for women against heart attacks. So after we go through menopause, we lose that benefit, we start to catch up to men. And then a family history of heart disease. So a family history means a first-degree relative. That's your dad, your mom, your brothers and sisters. Aunts and uncles and cousins don't count. And then you always have to really think, is it genetics or is it just the way I was raised? Does that make sense? So I have met several people who really do have a genetic predisposition for heart disease. They know it, they exercise, they're fit, they eat healthy, they take their meds, and their cholesterol is still off the charts. Their blood pressure is still horrible. Those are the people that really are genetically predisposed. A lot of us, it's just more the family habits that we're used to. You're used to eating certain dishes, meat and potatoes, not eating as many vegetables, maybe not being as active as a family growing up. That's just more of the nurture aspect versus nature. Okay, things that we can control. Smoking, high blood pressure, high blood sugar, high cholesterol, your weight, how much you exercise, and how well you control your stress. This is my disclaimer though. Even healthy young people can have heart attacks. It sounds so pessimistic. There's no guarantee. You can do everything right, eat right, exercise, take your meds, and you can still have a heart attack. However, if you are being healthy, if you are taking care of yourself, the chances are if you have a heart attack, you will survive it and you will recover better from it. So how do you prevent a heart attack? There's a lot that you can do. Make sure that you see your doctor regularly. Go in for your annual physical. Get your blood pressure checked, get your cholesterol checked, get screened for diabetes, and tell your doctor what's going on. He's not going to know that he needs to treat you or check into something if you're not telling him. So I was exercising, but I get too worn out now, so I'm not anymore. That's good for him to know. Take your medicine like you're supposed to. If you don't want to, talk to your doctor about it. Don't just stop taking your medicine. I know it's a bummer to take a lot of pills, and there's side effects that we don't enjoy. Talk to your doctor about it. I have found most doctors are really open to discussing it. They're more than happy to explain the reason why they want you to take the medicine. Most of them are willing to find a different medicine that might be better for you or find some sort of option that doesn't involve medicine. Talk to your doctor. They're on your side. Manage your stress. We're all stressed out people. If we're not stressed, we're dead. It's how we learn how to cope with it. I just got done talking up in Tremont, and I had a guy tell me, well, if I'm mad at you, I'm going to let you know, and I'm going to call you a dirty, rotten so-and-so, and then I'm over it, and I'm moving on. He goes, my wife remembers things from 20 years ago, and she carries a grudge, and she still fumes about that. Those are two very good examples of how to manage your stress. I don't know if I recommend either extreme, but address it, deal with it. Don't shove it down and let it stew for 20 years and build up. On the other hand, don't necessarily go and yell at someone and punch a hole in the wall either. Exercise is a great way to manage stress. Talking about it, if you've got a close friend that you trust. Journaling. There's a big emphasis on mindfulness nowadays. Have you guys heard of mindfulness before? It's very, very similar to meditation, but we're saying mindfulness so we don't sound like hippies. It's very helpful. It's just focusing on your breathing, calming your thoughts, being in the moment. If you smoke, quit smoking. If you don't smoke, don't start. Most of the time, by the time you're in this age group, you're not going to start smoking. If you are trying to quit smoking, I understand that it is incredibly hard. My dad likes to remind me of that. He quit a long time ago when I was 5, and he still points out to me, he's like, it's really hard for people to quit. You gotta be nice. It's very addictive. It's harder to quit than alcohol or drugs. So be kind to yourself when you quit. I do recommend quitting cold turkey. So instead of, I'm just only going to smoke 2 a day, or I'm going to go to the e-cigarette, quit completely. It's just easier to not even have that temptation around. I mentioned the e-cigarette, and I didn't last time. This is very important. Smoking cigarettes is bad for you. nicotine in general is bad for you, whether it's chewing tobacco, whether it's the e-cigarettes. Nicotine raises your heart rate, it raises your blood pressure, so it stresses your heart out more than it needs to be. If you quit smoking and you relapse, you have some sort of stressful event in your life, you lose a loved one, you go through a divorce, I can't take it anymore, I have to have a cigarette. Forgive yourself. It's okay. That time that you didn't smoke, your heart got a break. It got to start healing itself and recovering. And hey, you didn't smoke for a week or a month, you can probably do it again. So forgive yourself if you smoke a few cigarettes. Try again. It's practicing quitting. Every time you try to quit, you're giving your heart a break. If you have diabetes or have been told you're pre-diabetic, manage your blood sugar. High blood sugar is horrible to our bodies. The effect that it has on our bodies is like an acid. That's not what it is, but that's what it does. It destroys our nerve endings. So people with diabetes, I'm sure you've heard they have neuropathy in their feet. They can't feel their toes. They don't feel when they stub their toes. Their eyesight is affected. It affects your kidneys. When it comes to your heart, it increases the buildup of that plaque exponentially. So high blood sugar makes the inside of your arteries inflamed and puffy and irritated. Then you add some high blood pressure on top of that. Someone cut you off in traffic today. You got in a fight with your spouse. Your blood pressure goes up for a little bit. It stretches that artery out, and it's puffy, so it's going to crack and bleed on the inside, just like your skin. And it's going to form a scab on the inside of the artery, just like your skin. But you've got cholesterol floating by all the time, and it's going to get stuck on that scab very easily, and that buildup is going to happen very quickly. If you drink alcohol, do it in moderation. That's 1 drink a day for women, 2 for men. And then eat well and exercise. And that's where we're going to spend the rest of our time. First of all, a warning before we go on, if you eat healthy and exercise, you will become more awesome. So what does it mean to eat healthy? Everyone likes diets, I think because it's structured and someone's telling us what to do. I hate the idea of a diet though, because there's a starting and a stopping point. Why do you start a diet normally? To lose weight. After you lose however much weight, what do you do? Yeah, you go back to eating the way you were before. Like, hey, I lost that 20 pounds. I'm good. Let's go celebrate and we'll go to Chuckarama. I would rather you make small changes over time and it be a lifelong habit. The other reason why I don't like diets is there's a lot of extreme ones out there where you should only eat cauliflower every day, or you only juice. It's out there. There's stuff. Oh my gosh. So no one can sustain that. No one's going to want to eat grapefruit for the rest of their life. You do that for 2 weeks, and then you say, that's enough of this, and then you go back to the way you were eating before, and you overindulge, and you're worse off now than you were before. If you do want a structured diet plan, if you do want some guidelines, I recommend the DASH diet or the Mediterranean diet. And they're not necessarily meal plans, but they are good general guidelines. The DASH diet stands for Dietary Approach to Stopping Hypertension. It is a heart-healthy diet. Mediterranean diet is, the emphasis is eating a lot of plant-based foods. It allows for meat, but in limited quantities, limited meaning, a few times a week. And pick your battles. If you like your red meat and you can't give that up, You gotta have beef. Make it lean. Get a sirloin instead of a New York strip steak. Choose your cuts better. If you like your pop, you have to have your Coke every day, maybe you just switch to diet. Or if you like your candy, if you need a chocolate bar every day, everyone's different, so I'm just throwing out some ideas. If you like your candy bar every day, don't get the king size, get the fun size. So don't give it up completely. Don't deprive yourself to the point where you give up. Just make those small changes, and then once you've got a couple changes down, you think you're doing good, maybe you can make a few more. The big idea, though, is to eat more plants and less animal-based products. I'm not saying get rid of it completely, but maybe switch that ratio just a little bit. Exercise is the best drug out there. If pharmaceutical companies could bottle up exercise, they would make a killing. And everyone would buy it too, because who wants to exercise? These are just a few of the benefits of exercise. There's many, many more. But it will help you lose weight or maintain weight. It will help lower your blood pressure, your cholesterol. And I said lower high blood sugar. I'd rather say it will help you control your high blood sugar. And of course, it helps you manage your stress. So who exercises regularly now? At least, every couple days a week at least, okay? So not everyone likes exercising, and that's okay. I have a couple of tips, or maybe more than a couple of tips, to help you get started, or maybe think of some ways to make exercise work for you, work for your lifestyle. Ideally, the American College of Sports Medicine says you should exercise 5 to 6 days a week, 30 to 60 minutes a day. Who has that time, really? I mean, we're all busy, we've got kids, we've got our jobs, we have social obligations. Yeah, maybe in a perfect world we'd do that, but let's be realistic. If you can exercise 3 days a week, you're doing good. That's a good way to maintain it. It should fit better into your schedule that way. It can be any 3 days during the week, and it can change from week to week. If you can do Monday, Wednesday, Friday one week, and then you do Tuesday, Wednesday, Thursday the next week, that's okay. And I would suggest starting with 20 to 30 minutes. So 20 to 30 minutes is enough to get your heart rate up. It's going to help lower your blood pressure. It's going to help change your cholesterol. And you'll be more likely to stick with it if you can do it in small amounts. There is no magic exercise out there that will fix everything. The best form of exercise is whatever you enjoy doing or that you hate the least. For some of us, it's running. For other people, it's swimming, hiking. I'm trying to think of some fun things out there. Rock climbing. There's all sorts of ways to get your exercise in. Dancing, square dancing is a good way. Add variety. If you're on the treadmill every day, facing a white wall, you're going to get bored and you're going to give up. So maybe get on the treadmill facing a white wall a day or two a week, but then go outside and walk, or go up in the mountains and go for a hike. Find ways to change it up so you don't get bored and burnt out. Play mind games with yourself. And I would love to follow up with you guys and see what you think about this. So you get home from work, you're tired, you gotta make dinner, you've got a million things to do. Tell yourself you only need to exercise for 10 minutes. Go out for a walk for 10 minutes, hop on your bike for 10 minutes, say, Danica said I only have to do 10 minutes. I'm pretty positive by the end of the 10 minutes you'll go, I could probably do 5 more. After that, I could probably do 5 more. You just kind of have to bargain with yourself a little bit. Find a workout buddy. If you're meeting up with someone to go for a walk in the neighborhood, walk around the track, you're more likely to show up. You don't want to let them down. Oh, well, it's cold and dark outside, but I know they're out there waiting for me, so I got to go. You're going to be more likely to stay committed. Sign up for an event. I was going to say sign up for a race, but some people don't like to compete, and that's okay. So 5Ks are great, but you can also do charity walks. You can do these weird obstacle courses that they have around here. Just something to an end goal that you are training for, that you're working towards to get in shape. I already talked about getting outside. Highly recommend it. I think the time goes a lot faster. It's a lot more enjoyable if you can exercise outside. Get the right gear. It might be a little bit of an investment to start, but get a good pair of shoes. You want a pair of shoes that's breathable, that's supportive, so you don't end up with blisters, so you don't end up with, it's plantar fasciitis. Have you guys heard of that before? It's basically hurts to walk on your feet. Wear comfortable clothes. Sometimes all that you've got for the time that you have is what you're wearing. That's okay. But when you can, wear some comfortable gym clothes that allow for some freedom of movement that maybe is a little more breathable, so your sweat doesn't bother you as much. And start slowly, kind of what I started off with on this slide. Don't overdo it. I'd rather you start with 3 days a week, 20 minutes each time, and make that part of your daily, your weekly routine, where if you don't get that in, you notice it. Like, oh, I didn't exercise this week. That's why I'm feeling so ornery. Once you notice that that's part of your daily routine, you can't, or it affects your day if you don't do it, maybe add in another day. Maybe make your exercise session a little bit longer. But you want that base. You want that foundation. So, to close, remember, a heart attack happens when the heart doesn't, or a part of the heart doesn't get the oxygen that it needs. There's a blockage in one of the arteries. Heart attack symptoms can be very different from one person to the next. I forgot to throw this in earlier. I had a patient years ago who was a firefighter. So he was used to treating heart attacks all the time, recognizing the symptoms. He had a heart attack and didn't recognize it because he had pain in his ear. So symptoms can be very different from one person to the next. If you think you're having a heart attack, call 911. The sooner you can get treated, the less your heart is damaged. People who have a lot of risk factors are more likely to have heart attacks than those who don't. However, there are no guarantees, and sometimes life isn't fair. I did have someone point out that, well, my dad drank and smoked till the day he died, and he lived to be 95. That happens, but that's generally not the rule. And it's important to take charge of your health. Be aware of what your blood pressure is. Be aware of your cholesterol. Talk to your doctor about your concerns. Be active. Get in shape. It makes a huge difference in the long run. I have met so many elderly people in their 80s and 90s who have just stayed active. They've not done anything crazy like running a marathon or doing an Ironman, but they've just stayed active over the years, and they act so young. They're able to still do so many things that they were able to do when they were 20 years younger. On the other hand, I have worked with people in their 40s and 50s who are not active, who don't take care of their bodies, and they act like the 80-year-olds should. So it makes a huge difference in the long run, what choices you make. I think I went through that a little fast. Do you guys have any questions for me?
What's the difference then between a heart attack and stroke?
Where the blockage is. So a stroke is a blockage in your brain. It can be caused from the same thing, though, that coronary artery disease. You can form that plaque in any artery in your body. So a blockage in your brain is a stroke. That can be, you've got your carotid arteries on each side of your neck. Those can start to have plaque buildup, and little pieces of that can flake off, travel to your brain. Those cause mini strokes, or a bigger chunk can come off and get lodged and cause a major stroke. It's not as common, but you can also have a stroke from an aneurysm in your brain, which is a weakened part of a blood vessel, and that's a brain bleed. Those are a lot more serious, but thankfully a lot more rare.
What's the difference, like, if you drink regular soda versus diet? And I've heard the flip side is like diet drinks contain aspartame, which is not supposed to be good for you either. So I'm like, oh.
Yeah.
I'm trying to justify because I drink leaded, not unleaded, so.
Okay. What's the difference between diet and regular soda? So it's not ideal to drink soda at all, whether it's diet or regular. But the difference is there's no calories in the diet. So as far as your cholesterol, what your cholesterol numbers are, your weight, diet's better. The aspartame really isn't a big issue unless you're drinking large quantities of diet, which I have met people out there that drink like 3 liters a day. Yeah. And that's still not going to be enough to be really harmful. The downside with the diet is it is sweet. Our bodies are weird. So it's sweet. Our bodies think that, oh, there's calories coming, there's food coming, and there's not. So it's geared up to process some calories. So we end up giving it calories another way. Eating a little bit, snacking, it makes us hungrier. So that's the downside. But you got to pick your battles. I have worked with several patients who just gave up regular soda and have lost 10 pounds just from giving up regular soda, not making any other dietary changes. Does that answer your question?
Yeah.
Are you going to switch? Maybe? Okay. I'll answer his question and then yours.
On when the arteries are filled up or filling up with plaque, so making those changes as far as diet and exercise, that reduces that, gets rid of that, cleans it out, or is it just not flushing?
Oh, that's a good question. I was hoping that would come up. So if you eat well and exercise, does that reverse the buildup of plaque in your arteries? No. You can, if you wanted to be very extreme, eat vegetables, work out a lot. You can maybe reverse it by 1 or 2%. And there's a group of cholesterol drugs out there called statins. That can reverse it by up to 3%. That's about it. You're basically stopping the plaque from getting worse. You can actually change the composition of that plaque a little bit too. So there are hard plaques, hard blockages, and soft blockages. What do you think we want if you have to have one or the other? A hard blockage in your artery or a soft one? A soft one, it's going to move with your artery. It's going to be more flexible. If you've got a hard blockage, and you've got that blood pressure, it's more likely to break open and cause a heart attack.
That actually was my question.
What was?
That was my question.
Oh, if you can reverse the,
Well, or if there's once it's built up, if it's there, there's nothing to do about it, if there's a Drano effect.
no. No, I'm so glad you brought that up. In getting ready for this, I was Googling heart attacks and heart disease and trying to find videos, and man, there's a lot of stuff out there. And are you guys familiar with Pinterest at all? I put it in Pinterest, and you're welcome. There's all sorts of like juice cleanses out there to get rid of your blockages of your plaque, they don't work. No. No. The only way you can get rid of that is a doctor can go in and can kind of roto-root it, but it's not very effective. Mhm. Yeah, they can take a little drill and take a little drill and kind of
But when you
get
do
some
have
of it
heart
out.
attacks, they obviously do something
They do.
to
Okay.
stop it.
So a lot of times they do an angioplasty or a stent. So an angioplasty is a balloon. It's a very tiny balloon. They inflate it with saline. So at a very high pressure, they poke it into that blockage, they inflate it, and it squishes the plaque off to the sides. So you don't get rid of it, but you just kind of flatten it out. Stents are more effective. They're like little metal springs or Chinese handcuffs. Have you ever seen the Chinese? That's what I like to think of them. So they're flattened out. They go over the balloon. It goes into the blockage. They open the balloon, and it pops the stent open. And it just smushes that plaque out to the side. So you don't get rid of it. No. No. Anything else?
What about, the Atkins diet and the ketos is so popular now where they're just eating protein. What is that? That scares me to death, but
Good.
people seem to have results with it. One person is always giving testimonials of how he's been to the doctor and he's checked his cholesterol and he's checked this and this and this. And he is, so good with all of his levels and everything.
Mm-hmm.
It's not the same thing as the guy that smoked and drank for 95 years and lived.
Yeah.
He just had good genes or what?
Yeah. So I have to repeat the question. They're recording me. So the question is, what about the Atkins diet and the keto diet? Is that healthy? Is it a heart-healthy diet? Does it work? So the Atkins diet and the keto diet, the basis is lots of protein. The keto diet actually takes it further and says lots of fat. So really limits the amount of carbs that you take in. And with that, the variety of food, the plants, the whole grains that you need. Those diets are effective. You lose weight on them. A lot of it is because you're just restricting calories. It's just another form of calorie restriction. I actually talked to a dietitian about this a few weeks ago. That's not my field of work, so I wanted to get her opinion. If you do the keto diet, if you do the Atkins diet, you go into your backup fuel system. So your primary fuel system runs on carbs. It's the most energy efficient. We feel good on when we use that system. If we go into ketosis with the keto diet, we're burning protein and fat for energy instead of carbs. It works. It doesn't work as well, though. You're going to feel tired and sluggish and have headaches. And it's not sustainable. I don't know very many people who live on the Atkins diet year after year after year. I especially don't know anyone that's on the keto diet. That's definitely a start and stop. Plus, the variety of food is not very healthy either. You're allowed to eat lots of bacon. You're allowed to eat lots of meat and lots of fat. And it does limit the plants that you eat, especially the whole grains. If you're not getting whole grains, you're losing out on a lot of vitamins. You're losing out on some fiber. Fiber actually helps lower your cholesterol, as well as I think they limit a lot of starchy vegetables too. So you're losing. No fruit. So you're just losing out on all of those nutrients that your body really needs to function well. I would not recommend it. Anything else?
You suspect somebody's having a heart attack, besides calling 911, what's your first response?
If you think someone's having a heart attack, after you call 911, give them an aspirin. Make them comfortable. The more that they can relax, the less stress is on the heart. If they're still conscious but they're struggling, they're uncomfortable, just stay with them and comfort them. If they lose consciousness, then you need to start CPR if you're CPR certified. Evaluate if they're still breathing. If they're not breathing, start giving rescue breaths. If they're not breathing, check their pulse. And start chest compressions. Do you guys do the hands-only chest compressions? Have you heard of that? It's the way to go. Really, most adults, if they don't have a pulse, they're going to have enough oxygen in their blood for a few minutes. You don't need to worry about giving them more. You just got to keep that blood circulating to get oxygen to their body. Okay. With that, I think I'll wrap it up. Thank you, guys.